Welcome to Gunurosai. Today, we're diving into one of the body's most powerful defense mechanisms, acute inflammation. You might think inflammation is just about swelling or redness, but it's actually a complex and finely tuned process that protects us from infections and injuries. From the first wave of immune cells rushing to the scene to the signals that tell the body to heal, we're going to break it all down so you can understand every step and every molecule involved. Let's get started. Acute inflammation is a fundamental biological response to injury or infection. It is a rapid and localized reaction, crucial for eliminating harmful stimuli and initiating tissue repair. But what exactly triggers this process, and how does the body regulate it? First, let's explore what inflammation is. In simple terms, inflammation is the body's defense mechanism to clear out damaged cells, irritants, or pathogens. When tissues are injured, the immune system activates an inflammatory response to protect the area from further damage. This response is triggered by various stimuli, such as infections, tissue necrosis from ischemia or trauma, and even autoimmune reactions. Acute inflammation is typically characterized by 5 cardinal signs: redness, heat, swelling, pain, and loss of function. These symptoms are due to increased blood flow, capillary permeability, and the migration of immune cells into the damaged tissue. One of the first events in acute inflammation is vasodilation, where blood vessels expand to increase blood flow to the affected area. This causes the redness and warmth that we often see in inflamed tissue. Alongside this, the permeability of blood vessels increases, allowing plasma proteins and immune cells, especially neutrophils, to leave the bloodstream and enter the tissue. Neutrophils are the first responders, playing a critical role in combating infections and cleaning up debris. They are responsible for engulfing pathogens in a process known as phagocytosis, and they release enzymes that break down dead cells. As neutrophils work, they release chemical mediators that recruit more immune cells to the area, enhancing the inflammatory response. However, inflammation is a double-edged sword. While it helps remove harmful stimuli, if uncontrolled, it can damage healthy cells. This is seen in diseases where the immune system attacks its own tissues, such as in autoimmune diseases or chronic inflammatory conditions like rheumatoid arthritis. As the acute phase of inflammation progresses, the body initiates mechanisms to resolve the inflammation and begin healing. Damaged blood vessels heal. Immune cells either die by apoptosis or leave the area through lymphatic drainage, and anti-inflammatory mediators like TGF-beta and IL-10 ensure the response does not spiral out of control. The final phase is the tissue repair process. Depending on the severity of the damage, the tissue can either regenerate or form a scar. Regeneration occurs when the cells in the affected area are capable of dividing and replacing the lost cells. If this isn't possible, fibrous scar tissue forms, which may lead to functional impairment of the tissue. So, why does all of this happen in such a coordinated way? Simple balance. Your body is always trying to balance fighting off threats while protecting itself from harm. Too little inflammation, and you can't fight off infections. Too much, and you risk damaging your own tissues. It's all about precision. In short, acute inflammation is your body's way of jumping into action when there's danger. It's a carefully controlled, multi-step process involving blood vessels, immune cells, and chemical signals, all working together to protect you. And that wraps up our deep dive into acute inflammation. We've covered everything from vasodilation to how your immune cells know where to go and what happens when inflammation resolves. I hope you now see how incredible and precise this process is. In our next video, we'll be exploring chronic inflammation, what happens when this response doesn't shut off properly, and how it can lead to long-term health issues. Make sure to subscribe to Gunurosai so you don't miss out, and thanks for watching.